I think it's about really catching up with science and then saying, if it's not good for people that are pregnant, people that have kidney issues, then there must be something to it. Why not just ban it? Because we have replacement options.
Dr. Elmar Jung asks why fillings containing mercury are banned in the EU but still used by the NHS.
There is research that brings the mercury in the brain together with neurological diseases, and we have challenges with the gut because it changes the gut microbiome. We can have physiological and psychological issues like mood changes, anxiety, depressions.
He says we should be questioning the science on the safety of amalgam fillings.
What we are told is that when it's in your mouth, it stays there, it's inert, and nothing happens.
Right.
Now, that would be really good if it's like that. We had a mercury vapor measure device in one of the practices, and we had to look what's really happening to those fillings.
Dr. Jung talks about the holistic view of connections between teeth and internal organs and the impact of modern lifestyle.
In the 1920s, there was Weston Price, and he looked at different tribes, remote tribes. They didn't have a word for cancer, they didn't have a word for tooth decay, they didn't have a word for gum disease because it was just not in existence. And they had these wide, these broad smiles and jaws. So why is that? And that brings us to our civilized food and diet with a lot of sugar.
Yeah.
So if those people are introduced to our diet within 1-2 generations, the jaws shrink, tooth decay sets in, and gum disease.
Welcome to British Thought Leaders. I'm Lee Hall. Today I'm sitting down with Dr. Elmar Jung, one of the UK's leading holistic dentists. And welcome to the show.
Thank you very much for the invite. It's a pleasure to be here. Thank you very much, Lee.
So you started off on the path of mainstream dentistry and then you moved to holistic dentistry. Can you explain to us what the difference is and why you made the switch?
Well, I made the switch very early in my career, actually already during university, because when it comes to treating patients, we first learn to treat on a phantom head. And so the first thing that we were allowed to do was placing fillings.
Right.
And that kind, it was amalgam fillings. And just a few years ago in chemistry lessons in high school, we were told mercury, which is more than 50% of the amalgam fillings, is the most toxic material on planet Earth. Don't touch it. So that was a bit of a conundrum to see that we now use that on patients. But when you want to succeed at university, you don't really question too much so that you get your certificate. So that was already the beginning of me looking what else is there, brought me into homeopathy. And then you go to conferences, you go to training courses, you meet others who have been on that road for quite a few years. And they then give you advice, what you can do, what else is sensible. And so that was actually my beginning. So when I first started my original clinic in Germany, then we didn't use amalgams. We went straight to composite fillings or inlays.
But do you think, looking at Britain, do you think people maybe put a bit too much trust in their dentists?
I think it's important to trust your dentist because that's why you go there. It's like with every other dentist. My goal really is to inform, to give an extra perspective on things so that people can make a choice. Because oftentimes they're not told that there are other options or what the real risks with certain treatments are. And that's more what I see, not going against conventional dentistry, seeing it as a part of everything, and holistic dentistry is part of that because it offers for those who wanted something that is more than just the conventional part.
So looking at the fillings issue, I think 1/3 of NHS fillings are this amalgam, as you're saying, has mercury in. Can you talk to us a bit more about this substance and your thoughts on it?
Well, amalgam fillings are at least 50% mercury, the rest is silver, tin, zinc. And what we are told is that when it's in your mouth, it stays there, it's inert, and nothing happens.
Right.
Now, that would be really good if it's like that. We had a mercury vapor measure device in one of the practices, and we had to look what's really happening to those fillings. So when the patient came for their initial consultation, we then put that lead of the measurement into the mouth. When we didn't do anything on the filling, there were hardly anything coming out, but as soon as we rubbed the tooth...
So like brushing your teeth, basically.
Exactly.
Right.
Then this shot up. Now, to put that into perspective, the maximum allowance in the workspace in the UK is 20 microgram per cubic meter. When we rub the teeth, some teeth, they shot up to 50, some to 70, 150, 470, 100. And
so way beyond the safe.
Way beyond this safe measurement. And if we then think how often do we brush the teeth, or even when we chew or grind our teeth and the fillings come together, then this releases. It also releases amalgam or mercury vapor when you have dissimilar metals in your mouth.
Right.
So let's say you have a gold crown, and that could be a metal bonded crown, so it has a core of gold alloy, and on top of that is the ceramic. If you have dissimilar metals in your mouth, then you create a current. So it's like a battery effect. Really? So from the amalgam fillings, then you have the saliva, and you have the more precious material. So there is a flow from the dissimilar metal, the amalgam, to the gold. And that's why we sometimes even see physical in the gum blue or black spots, which is a concentration of mercury in that area. And so without even doing anything, you have more mercury vapor coming out of those fillings. And then what's happening? Well, you breathe it in, it goes into your lungs, and when it's in your lungs, it's in your blood, and then it's just everywhere.
How does that affect people?
Well, the effect is on many different levels. So because it's in the blood, it can also cross the brain-blood barrier. So it goes there. There is research that brings the mercury in the brain together with neurological diseases. And we have challenges with the gut because it changes the gut microbiome. We can have physiological and psychological issues like mood changes, anxiety, depressions. Now, not everyone who has depression has a mercury issue, of course. However, if you look and Google mercury intoxication, it's a very, very long list there.
Right.
And it's also that a lot of those amalgam fillings, they don't have underlinings. Underlining is a kind of filling not from mercury that protects the dentine from the mercury being directly on that tooth, which means that mercury vapor can also go directly into the tooth and then into the blood supply, because every tooth has blood supply, has nerve supply and lymph supply. So there are two ways how that can get into your system. And it's quite a challenge then to get it out of your system again. Now, we have more and more patients that suffer from mercury symptoms, and I'm pretty convinced that it's due to all the toxins that we get over the time from our environment, and therefore more and more people react to that. And that's why it's a good idea to remove amalgam fillings. Now, conventional dentistry often says removing amalgam fillings is even worse than having amalgam fillings, and they're absolutely right. They're right as long as it's done conventionally, as long as you just drill the fillings out like you do it with composite fillings, for example. And therefore it's very, very important, I think essential, to use a protocol that protects the patient and also protects the dentist and the nurse.
So when you go to the NHS, you get the choice. Do you want the silver filling or the white? So it's saying the white is safe. It's the kind of the silver one that we have the issue with.
Well, they are definitely safe because they don't have any mercury.
Okay.
What they have is often other materials like BPAs or other hormone disruptors, fluoride, and that can cause an issue for sensitive patients. So it's important when you get rid of one that you make sure that what you get as a replacement then is actually what your body is capable of dealing with. So very important to ask, what ingredients do I have in this new filling, and is this anything that might potentially be of harm to my system? And as we discussed earlier, because we are getting more and more sensitive to anything that comes into our life, I find it's very important to have something in the mouth or anywhere in the body that we know is the least material, the least toxic material that the body can actually cope with.
So Britain's dental bodies, the regulatory bodies, they say patients should not be misled to believe that these amalgam fillings are unsafe. But then at the same time, the EU has banned them. I mean, how should we understand those two different approaches?
Yeah, the question really is what is behind that thinking, that when all over in the world they say they ban it, and not just for pregnant women or small kids or people with kidney diseases. No, they just banned it. And that was this year, 1st of January 2025, they banned it in the entire EU. So no one is allowed, no dentist is allowed to place amalgam fillings anymore. That must be a reason for that. So, and research just shows what we discussed earlier, that there are so many symptoms from mercury, and there's also an environmental issue with that. So for example, cemeteries, they need to put mercury filters in their cremation process, because otherwise that is all coming out and is contaminating the area around the cemeteries.
You mean from people who have a filling being cremated?
Exactly.
Oh, right.
So I think it's about really catching up with science, and then saying, if it's not good for people that are pregnant, people that have kidney issues, then there must be something to it. Why not just ban it? Because we have replacement options. That is at the moment, I think, a particular reason why the GDC says we can't replace it, because there is nothing there that we can use in the same way. It's not as cheap. And I think that is somewhere where the GDC needs to look into science and talk with their colleagues in other countries. What is going on? How do they replace it?
But do you think it's a price issue? Because, I mean, we have the white filling that could replace it, but we keep using it even though the EU have banned it.
There's definitely a price issue if we look just at the single filling. However, if we look at the entire pricing, which means the environmental effects that amalgam has, then amalgam all of a sudden becomes a very, very expensive filling material. If we then look at the health implications of the patients and the need for certain treatments for them, the tests to find out whether that is an amalgam or mercury issue, then it becomes very, very expensive.
So moving on, I also wanted to talk to you about root canals. I mean, what's the process with them and what are the risks involved?
Well, root canals are absolutely a fabulous idea, because you can keep the tooth. So let's say the tooth has a huge decay, the tooth has died, but you don't want to get rid of your tooth. So a root canal is an option to keep the tooth in place. Now, from a just working point of view, it's a great idea, because you keep what helps you chewing, which is the tooth. If you then look at a bigger perspective, you have all of a sudden a dead organ in your body. Now, very interestingly, it's only dentistry that thinks it's okay to leave a dead body in the
Right, a
body,
dead organ in the body.
in the
Yeah.
body.
Right.
Everywhere else, if your appendix dies or your gallbladder goes highway or you have a gangrene, then they say, well, we rush you to the hospital, get that out because that affects your overall health. Now with root canals, that's not a very dramatic and acute situation. That can take years and years, and not everyone, again, is affected by that. However, the big challenge is, no matter how good you are as a specialist for endodontics, which are the specialists for root canals, you can only treat the main channels. And that might be 1, 2, 3, 5, 6, or 7, depending on the tooth. But you can't sterilize the tooth. That is the big issue. Right. So you will always have some kind of bacteria there. And they did research on that. They took a root canal treated tooth, ran it through industrialized sterilization, and they still found bacteria.
Right.
So that means you have a constant, what we call silent inflammation in that area. And then again, depending on how strong one's immune system is, one person can live with it and the other person has an issue with that. A lot of the times we don't see anything on the X-ray, and therefore we then say, well, there's nothing to see, so it must be okay. Another issue is that when you have a dead tooth, then when we look at Chinese acupuncture, so we have these energy pathways, the meridians running through the body. That means every single tooth is connected to different organs. So there were a couple of German doctors and dentists who made that connection in the 1960s. For example, your front teeth, upper and lowers, they're connected with the kidneys, with the urogenital system. So if one of those teeth die, the energy flow from that meridian can be blocked, can be less than what it's normally having. And so it could then be, or have a repercussion to the organs and all the parts in line with that.
So I saw the chart on your website. So is it basically that each tooth connects with different organs in the body?
Yes.
Right.
So, but that's just a main giving. You can also have teeth that then divert to other areas, but that's what research found. So, and then it's important to see how you can deal with that. What can you do? Well, you could use antibiotics, and antibiotics will help for a while. The challenge with antibiotics is that they will not cause the root cause to go away, because the root cause is the dead tooth. So what else could you do? Well, you could just say, well, I'll wait and see what's happening and live with it, do all the best you can with supplementation, with a proper diet. Or you can say, well, I now know that there is something that is not really good for me and I want to have it out. And then you decide to have the tooth removed. Now, to make the healing really work well, it's also important that the patient does their bit of the work, and that means they need to be very well supplied with supplements. And one of the very important levels is vitamin D. Now, in the UK, it's rather challenging to get a high level of vitamin D.
I haven't seen the sun for a while.
Yeah, although we had a very lovely summer this year. So that's what we test. And yeah, as you could imagine, a lot of patients have a very, very low vitamin D level. So we want to bring that up. Now, to what level do we bring it up? Because from what we know, 50 nanomole per liter is said to be a good level. Now, we'd rather have 130 or more to be sure that the patient is in a good position to heal and to maintain a strong jawbone, because that is what is so important, that the jawbone is healthy, especially if they decide to go for implants. Then you want a strong jawbone that can hold the implant in place, rather than you have the implant placed and a few months later you go back and it's wobbly. So it's very important that lifestyle, such as smoking, for example, gum disease. So patients really need to look into that, and dentists are really adamant that patients have those changes made before they get the implants, because otherwise it comes back to them. Well, you did the implant and now it's failing, it's your fault in a way. So it's a balance, it's a partnership between the patient and the dentist, and each of them has to do their own part.
I wanted to also ask you about wisdom teeth. I've heard so many different things on this subject. Some people say, oh, they have to be removed, it's really important. Others have said, like, don't remove them, whatever you do. What are your thoughts and holistic dentistry's thoughts on wisdom teeth?
It's a great question. I was working at a oral surgeon or a maxillofacial surgeon before I started my own practice, and it was like a factory. I mean, injection in one room and then going in the next and in the next, and he just ripped those wisdom teeth out. Now we have to say that over the years, decades, the mouth has shrank. So there's not as much space for all the teeth and not for the wisdom teeth.
For people generally,
For people generally,
right.
Exactly. And so one perspective is, well, if there's not enough space, we take the teeth out. And wisdom teeth are one of the first that then suffer that. From my perspective, I say if they don't cause any issues, leave them. Mm-hmm. And that brings us to another story, which is tooth extraction for children. So oftentimes the parents hear, let's wait until they're 12 or 13 years old and then we'll see what has happened. Or so we see very early that teeth are crowded and there's not enough space. So then when they're back at 12, 13, they are told, well, there's really not enough space, so we need to take 4 teeth out. And those 4 teeth are permanent teeth, healthy permanent teeth, to create more space. That's what is said. Now, we don't really create more space because in that space we put and pull the other teeth, so we haven't really gained more space. Which brings us to an area, how can we do that? How can we create more space? And that is already when the little ones pop out of the womb, that they get breastfed. Because with the breastfeeding, that's the ideal situation to really introduce the growth of the jaw, right. Because the babies, they need to push with their tongue the nipple to the palate, and that induces growth.
I knew there was a lot of benefits of breastfeeding, but I didn't know this was one of them.
And another benefit is they will start swallowing properly, they will start breathing properly. That has an effect on far less allergies, far less food intolerances, and less gut issues. Right. So it's a whole host of that. And that's also why the kids are so completely tired once they've been on the breast, because it's a workout for them. Right, it's a proper workout. And if you have normal bottles, they don't have that necessity to work. They almost drown, the babies drown when they drink from there, and there's no impulse there. However, even if that's the case, we can help them with myofunctional training, with a proper diagnostic, and sometimes even braces in young ages to develop those jaw bones, to develop the palate, so that when they are 12, 13 years old, that they are then in a state where there might be the odd tooth that needs a bit of a realignment. However, they gained so much space in the palate that it's absolutely fine. In the 1920s, there was Weston Price, and he looked at different tribes, remote tribes. They didn't have a word for cancer, they didn't have a word for tooth decay, they didn't have a word for gum disease, because it was just not in existence. And they had these wide, these broad smiles and jaws. So why is that? And that brings us to our civilized food and diet, with a lot of sugar, So if those people are introduced to our diet within 1-2 generations, the jaws shrink, tooth decay sets in, and gum disease. And they can reverse it again. However, we can see how quickly that evolves. So it's very important that we look what we eat, what we drink, and that parents are informed about that so that they can do the very best to help their kids.
Would you see sugar as the kind of main problem causer we've had in our society for dentistry?
Well, it's the sugar in a way that it causes a lot of acidity. And it's a big issue that you have sugar everywhere. It's also because a lot of parents haven't got the time, so they make ready meals. So we're living and having food that's more close to factory than to nature.
Yeah.
And that makes a big difference. The quality of the food, you can have meat and you can have meat. So grass-fed, grass-finished meat is a totally different story than a factory meat. So it has different parts, it's full of probably estrogens, growth hormones, antibiotics, and that's what's in us then when we eat that food. So it's very important to look at what we actually put on the plate. And yes, you can say it's more expensive. However, you also need far less of a good meat than you would need with others. Then people eat too fast, they eat too much, they eat too late, they don't chew properly.
I heard this quite a few times, that we don't really chew enough.
Exactly, yeah, because we don't have to anymore. It's all soft food. So if we have a proper steak, for example, or we have raw food, carrots, we really need to chew them. And in the chewing, in the mouth, digestion starts. So if we just do this twice and then swallow, there's far too little enzymes that have started to start the process of digestion. It then comes into the stomach, and that's not prepared to do that previous work. So it sits there and it gets then transported in a not properly digested way to the next stages. So yes, depending on what you eat, you should always look for 20 to 30 chews, and even things that are soft, it would be preferential to chew them so that enzymes go in there to help with the digestion. Very, very important. Coming back to mums with the little ones, there's nothing better for mums to detox than getting pregnant.
Right.
Because they detox during pregnancy and they detox during breastfeeding. Now, I'm not saying don't breastfeed so that you don't give toxins to your little one. What I would suggest is that even before you conceive, make sure you have as little toxins in your body as possible. So maybe think about having your mercury amalgam fillings removed, do a detox, and also the partner to do a detox. There was Boyd Haley, a chemistry professor in Kentucky, many, many years ago, probably decades ago, and he said that what he found in his research is that when the dad and the mum have both amalgam fillings, it could cause a genetic change that the offspring can't detox as good as they would normally do. And I had a situation like that. That was tremendous. About almost 30 years ago, where a mum came with her daughter, and the daughter had about 6 months ago started with not only toothache, but headaches, migraines. She got depressed, she couldn't concentrate anymore, brain fog. She couldn't be in school because she just couldn't sit still. So they had tests done, they had treatments done, but in the end, nothing really helped. And so the doctor and the headmaster, they said, well, that must be just, Christine was her name, must be Christine making all these things up.
Yeah.
So what we do, we section her.
Really?
We put her into a institutionalize her, and then she can see what she's done to herself, what she's doing to herself, and her environment. And her mum knew she's not making that up. So for whatever reason, they found us, and when she sat in the chair, the teeth looked absolutely fine. There was just one tiny little spot, an amalgam filling. And I said, so the symptoms started 6 months ago. When did she have that filling, or when was she with the dentist? And they said, well, probably half a year ago. And so I asked, was that before or after? And it was before the symptoms started. So light bulbs went on, and we removed that tiny little filling and did some detox, and miraculously the symptoms disappeared. And within 3 months, she was back to normal, one of the best pupils in school. Luckily, the GP said, yes, you can have her for 3 months and see what you can achieve. Probably happy that he got her off her list.
Yeah.
Now, what we need to see here is it's not the single amalgam filling that made it. That was just the last bit that broke the straw. Exactly.
Right.
Yeah. So it was what we were discussing earlier, the load that came from the mum, and we don't know what kind of medical schedule she had with vaccinations, because at that time you still had thiomersal in the vaccines, a mercury preservative. So, and it was just too much for the body. And therefore, very important, if you want to conceive, consider getting rid of your mercury fillings and all other things. Get a healthier lifestyle if you don't have one. Eat proper food that you as a mum can provide very well, because now you need to feed 2 people.
Also wanted to ask you about fluoride.
Yes.
So I mean, on this side we hear fluoride is in most toothpaste, it's in the water supply in some areas, it's really good for your teeth. Over here is saying fluoride is bad for you. Do you see fluoride as a good guy or a bad guy? It
really comes, as you said, on the perspective. So if we look at water fluoridation, for example, what does fluoridation of the water mean? It's a mass medication in a way. And the big challenge is we don't know how each of us, how much we take in, because we have patients or people that drink 2 or 3 liters a day. They do a lot of sports, so they will have a far higher take-in on fluoride. And kids are very, very susceptible to any kind of toxins, so we need to be very careful of what we can allow. If we just put it in the water, we haven't got a clue who gets what, and no one has given a consent to do it. So if it's done locally on the teeth, there might be help for that. Also, that's debated. And there's even a research, Cochrane research, where it says that the benefits are very, very little. There was a city in Switzerland, it was either Basel or Bern, and they did water fluoridation for 20 or 30 years. And then they gathered the data, and to their astonishment, there wasn't anything that said, yes, it's worth continuing with the water fluoridation. So they stopped it. And many other countries never did water fluoridation. They just never thought of that. It's the same with mercury. Russia never used mercury for fillings. So that was just never a discussion.
I think here it's just Birmingham, I said, that does water fluoridation.
Yes, it's a small area where they do it. They want to do more, and there's an initiative out to do water fluoridation in the entire country. I think they need to look more into the upcoming science, because what we know, and that's a fact, that fluoride affects your IQ, and especially with kids, that's an issue. So it lowers IQ, can make the bone brittle, and also for people who look more into spirituality, it calcifies your pineal and pituitary gland. So that's not something that is very beneficial if you want to pursue that road, that journey.
It seems several of the points you've made have this same theme of like the science isn't quite keeping up with developments. And do you think that's an ongoing thing?
Well, we know that when they said the atoms are the smallest parts, then science said, no, we need to go further and further, but there wasn't any apparatus any devices to find that. And then they developed the machinery, and then all of a sudden it's the protons and it's the quarks or whatever. So I think we can only measure what we have the gadgets for. And that is where it's a big issue with the gold standard, the randomized controlled trials. They focus on one particular thing. So if we have the London Symphony Orchestra, for example, we have all these violinists, we have the guitarists, we have the whatever musicians they are, and the RCT picks out one player.
Right.
And looks at that, whereas when we look at a holistic approach, then we look at the whole orchestra. And I think that's the important bit, that yes, it's important to gather data, however, we need to then bring that into real life. And a lot of patients who because RCTs are done due to we want to get a new drug out. So a lot of patients who might get that drug are already on 2, 3 or 4 or more. So where's the trial, what it does to them? Because it's a one-piece approach where we see what's going on here, which is great to know. However, it doesn't give us any idea of what does it do to the 60-year-old that's on antidepressant, that's on statin, and all the medications that he or she is already on. So I think that's a big challenge for those so-called gold standards, that they not really look at the real life rather than their lab and their intention, what they want to see. And we also know when we do research, the intention that we have can influence our results. We know that as well. So it's very important to look at all these things in perspective rather than take it as a fact. And as we know, a lot of facts are opinions anyway.
Yeah. And finally, I just wanted to ask you about a phrase that I noticed you use, which is like tooth, gut, brain.
Yes.
And can you talk to us about the connection between those?
Yes. So we have different microbiomes. We have a microbiome in the mouth, we have a microbiome in the gut, and we have a microbiome in the brain. And they're all interconnected. So the connection is through the vagus nerve, for example. And when one part doesn't play its role properly, all the other parts suffer. So if you have a gum disease, for example, then you have a completely different microbiome in your mouth, which then will change the microbiome in your gut, which will change the microbiome in your brain.
Right. So there's not one of them's kind of presiding over the other. Oh. Well, don't have like a leading one.
The brain is definitely one that's leading, because that's where everything comes together, whether that's the biome, whether that's the emotions. So it's very important to look into that. But once one is out, all the others need to either compensate or give in.
Right.
So that's a very important part. Brings us back to diet, because if we eat a lot of crap, something that's not really made for us, then our gut doesn't work properly. And the best indication is always to ask, how much toilet paper do you need? Normally we shouldn't use much. And if you need a lot, that means something's not quite right.
Right.
So a proper gut detox is a good thing to do. Gut detox, liver detox.
So is that like a juice detox or something?
That can be a juice detox. That can be something where you eat certain supplements to get rid of the biofilm. That's also about lifestyle changes, and is also about thinking about what you actually give your body. Because if we look at our body as a sacred temple, then we should feed it the best we can. So all those crisps and sugary things that are not really helpful, and the constant eating of things. So when we eat a good breakfast and then we pause for 4 or 5 hours, that's actually really good, because that gives the body the capacity to digest that, bring it forwards to the next stage, and that then rest. And then after 4 or 5 hours, the next part comes. And we also need to appreciate that organs have different times when they do their best. So the stomach, for example, the gut, they stop working very strongly towards the night.
All right.
So if you have a meal, a very fatty and big meal at 10 o'clock at night, that sits there for much longer as compared to if you had it for lunch, for example. And then you drink a lot with it, and the drinking then dilutes the acids in the stomach. And a lot of patients we see also, they already have a low stomach acid. So if you then eat meat where you need a lot of stomach acid, then it's again not digested properly. So it's a cascade of things. If you think we started with amalgam fillings, they can affect the gut microbiome. So per se, it can't work properly. So having replaced those already creates a completely different microbiome in your mouth, which then helps the rest of the body to become healthier. So very, very important. And one part that we haven't touched yet is the emotional part. And that's what we see a lot now. And why is it the lower right premolar that decays and not the upper?
Yeah.
So there must be a reason. And not only from my perspective are tooth decay and gum disease systemic issues, it's also bringing us back to the meridian, to the acupuncture points where energy doesn't flow properly, which is especially important when we do surgery, because surgery, we want to have a really healthy jawbone, a very good healing, and by then removing those energy blockages helps the body to do its job. And that is very important to look into that. And that could be some blockages that we gathered in this lifetime, got from our parents, some are from ancestors spiritually or even karmic. And that can be released, and then the body can heal much better. So we know that emotions are a very important part. If we look even further and more in a bird's eye view, we could even say that we get physical symptoms if we don't listen to our body, because our body gives us information, so that the soul gives you little hints. But do we really listen? Have we learned to listen? Well, most of us have unlearned to listen, and so it needs to make it a little bit harder. So it then gives us physical symptoms so that we can look at that. And this is where this emotional work is so important. Gadrike Hamer, for example, he found that on CT scans he could see areas in the brain where changes have happened, for example, for cancer patients. And that was very interesting what he then said. About a year or two before the diagnosis of the cancer, there were certain emotional events. And once those events were dealt with, patients could almost heal then.
So kind of like how we see stress.
Stress, and yeah, exactly. Bradley Nelson talks about that in his book, The Emotion Code, how you can release those stresses. And I think this is so important to look far beyond just the mechanical approach of whether that's dentistry, medicine, or any kind of healing, that we get into what is really triggering us, and from our experience. And people can have a look at the testimonials. Sometimes it's miraculous. We had a patient, she had issues with her knee for 10-15 years, couldn't walk without pain. She came for dental treatment, didn't mention the knee, and decided to have a biophoton therapy. 2 days later she called and said, I have no clue what you did, but the pain in my knee has gone and I can walk. So there are a lot of side effects, positive ones, that happen. It just shows that we only have that kind of clue of what's going on in the body, but we think we know it all. However, nature is so much more clever than we are, and there's so much more to explore. And therefore it's important to offer that information, that knowledge to people, so that they can then make their own decision, that they can make an informed decision when they say, well, yeah, I hear what you're saying about root canals, but I'd rather have my own tooth. Fine, they know what reasons there are, and now they make the choice with even more certainty. Yeah, I want to keep it, and if something happens, okay, I know I can deal with it in a different way. And it's about giving choices and opening eyes so that discussion can happen and patients make their decisions, what they think is best for them, that they start listening to their body. I think that's the most important part.
Dr. Elmar Jung, thank you for joining us.
It was a pleasure. Thank you very much, Lee. Thank you.